At this time, we're going to switch gears and talk about respirations. Again, just as with oral temps or temperatures, Kosher also has a section in the book about contributing factors that can affect respirations. So let's talk a little bit about them right now. Of course, the presence of disease can affect one's breathing. And so some examples might be asthma or COPD, chronic obstructive pulmonary disease, and something as simple as a cough or cold can affect one's respirations. Similarly, one's age can influence respirations, in particular the respiratory rate, and I'll let you read in your book about the different respiratory rates for different age groups. Little children, they tend to use different muscles for breathing compared to other age groups. And again, they're obligatory nose breathers, so they have to breathe through their nose. The rest, if you look at smoking, exercise, pain, anxiety, and medication, again, no surprise to you that these sorts of things can affect respirations. Maybe you could think about a couple of medications on your own that you think can affect someone's breathing, and we'll talk about that when we get together in our small groups. As I said, normal respirations, we always put normal in quotes because there's such a variation, and it's hard to define normal in medicine. So what you'll find many times is that instead of saying normal, we'll often say within normal limits when we talk about normal ranges. So that's just an aside. But again, I'm going to have you refer to your book to find out the normal respiratory rates for these age groups. In 102, we're mainly focusing on adults and older adults. So I'll just tell you right now that for adults and older adults, the typical respiratory rate is 12 to 20 breaths per minute. And during each breath, the adult or older adult typically breathes in for about 1.5 seconds and then breathes out for about 2 to 3. So just test your own breathing right now and see if I am correct. So we've talked about the respiratory rate, but there's more to just counting a respiratory rate. There are other things that the nurse will assess than just a number. And so here I've thrown in a few terms to familiarize yourself with. So eupnea is kind of a great word, and it actually means normal breathing, meaning that the respiratory rate is 12 to 20 breaths per minute. The breathing is effortless, quiet, non-labored. So that's the definition of eupnea. The other terms that you see there are dyspnea. Dyspnea means difficulty breathing. Sometimes we use the term short of breath interchangeably with dyspnea. And then the other two terms that you see listed there are tachypnea. Tachypnea means faster than 20 breaths per minute. And bradypnea means slower than 12 breaths per minute. So tachypnea is faster breathing and bradypnea is slower breathing. Okay, as I mentioned, when we assess respirations, we're doing more than just counting a number. So there are a few other areas that the nurse needs to be aware of and consider. So again, we're going to count the respiratory rate, as I said, but you're also going to evaluate the rhythm of the breathing. Is it regular? Does it come at regular intervals, the breathing? Or would you say that the breathing is erratic or irregular? Because that could be a sign of a problem. The other thing that you want to evaluate is the depth of breathing, whether the patient is having shallow breathing or deep breathing is another thing that we're going to look at. Certain conditions, the person may breathe more shallower, and others, the person may be breathing more deeply. So that's another area that we're also looking at. And then also the quality of the breathing, whether there is any effort to the breathing, any noise, extra noise. We'll also look at the patient's color, and we'll also look to see if their patient is using any extra muscles or extra effort to breathe. So there's quite a bit to assessing respirations, and when we meet together as a group, we'll practice assessing respirations together. And then I'd also like you to review what else I have on this slide. It talks